Hi, this is Dr. Mark Sehl from the YouTube channel, Therapy for the Heart, because it's about the role of emotions in our lives. Thanks for being here. It's Tuesday, and I'm going to ramble around a little bit about transference, countertransference, and working with difficult patients. I never liked that term, difficult patients. I thought it was always placing responsibility on the outcome of therapy on the quote-unquote difficult patient. I think primarily it's the difficult therapist that needs to learn about his or herself, about what their blocks are in doing therapy. The case of Jane is a good one to start out with. There's a very difficult transference she had to me about that was related to her mother. Her mother was very controlling and criticized her when she made a mistake, forced her to eat tomatoes and rice. And when she didn't do the work well, she would pull her hair, scream at her. Her father was alcoholic, and that comes up later on in the talk, but because of that, he really couldn't give the appropriate attention to Jane, and also because of that, she suffered a lot of intellectual abilities, the development of her intellect, because there's been studies shown that the role of the father, if adequate and secure, will make a big difference in the development, intellectual development of the child. So she had it rough going. She had a mother who was very controlling, and control saps the life out of you. It doesn't really let you be who you are. And so when Jane was told to eat all her food, she would spit it out. The only way she had to rebel, and then the mother experienced that as a rejection of her love, and on and on and on. So she had a lot of contempt for me in the beginning of the treatment. She felt all I was interested in was making money by her and by her sickness, keeping her sick to make money. And of course that was a transference to the mother, because all the mother was interested in was trying to control Jane, so she would do what she wanted to do. All her own self-interest because of her own neglect in her upbringing. So the transference, the countertransference for me was a lot of trying to make her help her like me, and everything I would say to her, she would say, any insight or I tried to offer, what she said was, so what does that do for me? Over and over and over again. That was for a couple of years, and but I stuck with her. And talk about transference. Her first therapist promised to come back from Europe and resume treatment with her, and she never did that. She broke off her promise, and Jane met her in the street and said, "What happened?" She said, "I had to cut you loose." How was Jane supposed to understand that? And there was no explanation. So that transference to that also was to that therapist who rejected her. So that was, she was coming into the therapy with me with all that hate and hostility and feelings of rejection and hurt. So for 2 years I withstood it, the rage and the anger and the contempt, and I didn't attack her. I didn't throw her out of the treatment like the therapist discontinued with her. I never did that. I stayed with her to the end, which was very important to Jane. She said at one time, she says, "I know I'm a difficult person. I know." And she wouldn't say that consciously, but as the treatment rolled around in the third and fourth years, she began to tell me a lot of the things like I never knew. Like she said, I always knew, I knew that you were interested in helping me and you cared, but I couldn't let you know it. Why couldn't she let me know it? Because again, that's the transference. If she cleaned her own room, her mother would get all excited because she thought that her daughter was doing it for her. See, everything had to come back to the mother and doing it for her. So she began to surreptitiously take things in from me, like this famous lecturer at a conference once said about his patient with a similar dynamics: control over the daughter, even, and it was a very similar case. Even the mother of his patient forced her to eat tomatoes and rice. So I thought maybe we've been treating the same patient. But anyway, Jane, finally, I had to accept my anger. That was my countertransference resistance, kind of like not acknowledging how angry I was. And once I did that, I accepted what her mother couldn't consciously accept. She only acted out, by pulling her hair, but she couldn't consciously accept how angry she was at her Jane, because Jane, she was very needy of Jane's love. And that was the element that she could never become aware of, or even talk with Jane about. If she could sit down and say, I'm trying to control you because I feel so needy myself, and that's not fair to you. If she had that conversation, that would have changed Jane's life. Like most parents, if they have a conversation with their children, they can say, well, I don't want to be yelling at you because I want to be a better parent. Oh, what a breath of fresh air for the child, and they can be saved from a lot of grief. But parents often have a hard time doing that, and that's not to blame the parents, that's the way they were brought up. So I was the role of the eagle. I was the eagle in Jane's life. What does that mean? Well, she had a fantasy of being thrown off a train into which was composed of very cold people, into a desert, and into that desert there was a globe, and she broke the globe in two parts, and in two halves of lush valleys. What a contrast, right? From her cold people, her parents, to lush valleys, right? She created a fantasy of a world. This is a fantasy, by the way, that she had told me. So out of that one half flew an eagle, and the eagle, she got on its back, and the eagle flew her to a wise woman, and the wise woman was doing all these wonderful things, and when Jane tried to do them, flying, throwing these discs in the air and making beautiful colors, it all failed. And a storm broke out, and she went and beat the woman up. Now the woman signifies the mother who couldn't teach Jane about femininity and being a woman because she was so controlling and angry herself. So she got out on my back, on the back of the eagle, which was me, and she flew away and to safety. Now, the role of a father in the relationship between a daughter and mother, the role of the father often is to help the daughter become disengaged from the mother, so that the daughter can go out, and that the infant and toddler can go out and explore the world. And meanwhile, some mothers are pulling at them to stay, and don't want them to go far away. And that was like Jane's mother. So the role of the father just helps them to disengage from that symbiotic relationship. It's not a bad thing, symbiotic relationship, but it's just helped them. So I was the role of the eagle. She got on my back, and she directed me to the woman and had this fight. So eventually, when I became more aware of my anger, like my supervisor said, how do you feel about this patient? I said, I hate her. And that was the end of my problem. I just admitted my feelings, and sometimes I said that to the Jane, and she says, "Oh, I know." She wasn't surprised. And so the third, and fourth years, it became a movement towards affection and caring. And she would walk to my office and wear pretty dresses, and I'd admire her, and I said she looked very pretty, and we'd talk about going out on a date. She wanted to go out on a date with me, so I said, well, where would we go? What would we do? And we'd go for a walk in the park, and that was a nice part of the treatment. I had to overcome my fear of her being dependent, which is a fear that many therapists have, particularly beginners, but not only beginners. If you help someone talk about their fantasies, they're going to feel like it's like real, and they're not going to want to leave you. And well, that didn't happen. I had to get over my fear of her being dependent upon me, and so I resolved that. So we could talk freely about where we would go on the dates. And she said to me, "Well, you don't have sex with your therapist." She was warning me because her father was gave her slobberly kisses, and he was very seductive with her. And that's what you don't do that. You admire, and you can have sexual feelings for your daughter. If you didn't, you'd be crazy. I mean, because daughters are very beautiful, and as a matter of fact, when you're little, you have as a daughter, you often have the father's a prince, you know, and you're the princess. And of course, the father can have all sorts of feelings as long as you don't act them out. Fathers who repress their feelings are in trouble, because then they tend to act them out. That statistics have shown that. So I was very comfortable with my feelings about her, and I had fantasies about living with her, and and that was good. I mean, I allowed myself to do that. So, and she needed that because she never had that from her father. Her father just stared across the room and looked at her, just stared, no communication, probably in a drunken haze. And also, the father and mother would fight like hell. So, and she would burrow her head at night and cry. And the end of the sessions and the weekends were very difficult for her, separating from me. So, one time I walked out of the office and she was crying by a building, and I went up and I said, "What's wrong?" And I comforted her, and that was it. So she needed that kind of support. So the role of the eagle. Eagles are transitional objects. I mean, the father is a transitional object. He helps the child separate from the mother, go out into the world. You know how the father is often very active and playful and go exploring places, and so that's what I was. And in the end, she said, "You fulfilled the role of the eagle. You came from your world. The eagle came from his world into mine," and that was very important. And my feelings about her came from me, the positive feelings I'd had. She didn't ask for them, and that was very important too. So she eventually she ended up. She started college when she started with me. She started college, and then after she left treatment, she wrote me a letter and said that I'm now teaching and I'm on an equal level with peers. She never felt comfortable or equal with other women her age, because she was very envious of them and made fun of them, and because she was insecure. So this now she was teaching, and she was teaching. What amazing come from where she was to teaching and enjoying life and being on an equal relationship and equal par with other women. And she left treatment probably prematurely, because of something about finances, and so I remember I felt the loss, not at the time, but looking back, I said there's something I didn't resolve with my feelings about her leaving, which is probably true, but is neither here nor there, because she needed to leave. And as Searles, this famous writer of psychoanalysis, Harold Searles, he said, there comes a time in the treatment when the patient needs to leave. And that's not in all cases, but it was a little premature because she was starting to mourn her father, and for the first time. She used to ride on the back of eagles, pretending like the eagles were her father. See, there's the eagle. The eagle also appeared in a book that on the front cover of a book she bought and to read with me. She didn't bring it in to read with me, but I did start to read it. We talked about it, and that turned into a sour note for her, because she said, "See here, you're getting a lot, and I'm not getting anything." But she did get a lot out of that, and she said, "I don't think I ever make an impact on you." And I said, "That's interesting, because just as you were talking to me about how you like to visit museums, and the passion you had about telling me, I was very interested and struck." And later on, she said, "I knew you were interested, and I knew you cared, but I couldn't let you know that." Yeah, interesting. So at the end, she left treatment, and the person who turned out to be the most difficult, quote unquote, patient, who I thought about leaving treatment because of her way with me and her attacks. I didn't give up on her. I stayed with her to the end, and that's very important. Therapists sometimes unconsciously or consciously find a way to get rid of the patients when they when they're having trouble. They use their rationalization, difficult patient. But I don't think that's you can't, once you're working with a patient, that's your patient. That's it. So, countertransference is is all the feelings that a therapist has, like my anger, which I couldn't express. Countertransference resistance is a resistance to acknowledging that you have a certain conflicts with a patient, like the need to be right all the time. You know, therapists have all sorts of different things that they have to work out. You know, the need to be right, the need not to have a patient be angry with them. A lot of things that's why we have to go and training for years and years in personal psychotherapy, which is the most important part of the educational experience as far as I am, much more than the academic part. And that's why I have the psychotherapy training group where we meet and we talk about all the things that we wouldn't say out loud to other professionals, but they say them with me in the room, and they learn that whatever you can't say out loud, you're not going to be able to help the person that you're working with say either. So it's a training experience with them, experiential. So this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart, and talking about countertransference and transference and the quote-unquote difficult patient, and also, more importantly, the difficult therapist. So if you'd like to contact me, you can please like this talk if you can, and subscribe. And you can make comments if you subscribe, and if you have a Gmail account, you can subscribe. If not, then you can always find me on Mark Sehl on YouTube, psychotherapy, and write me if you like, marksehl@gmail.com, and visit the website marksehl.com. So thanks a lot. Remember, like the talk if you like it, and I'll be seeing you soon. This is Tuesdays with Mark. So I hope you enjoyed this talk. I'll be seeing you soon. Bye-bye.